So many women out there fear family planning, but at the same time, they don't want unwanted pregnancies or unplanned for children. The reason for fearing family planning is due to information they have gotten from their friends who have used some of these methods. Things like heavy bleeding, prolonged bleeding, and sometimes even total absence of periods. All these are worth noting. And in this episode, if you've had such questions before, or you've been wondering if family planning is something you can consider, then this episode will get you sorted. We are going to discuss family planning in detail, up with several questions that have been lingering out there, especially in our pharmacies whenever we interact with our patients. With me is Dr. Joseph, and I'm glad we are going to be able to receive all the answers that you've been looking for. Doctor, you're welcome.
Yeah, thank you, Jim, and it's a pleasure to be on the Masapharm Podcast.
So, Doctor, today I'm going to ask questions. These questions are coming from the viewers, people we have interacted with in the pharmacy, and others from the community. And the very first question, ladies out there fear the long-term effects, side effects of these family planning methods, not just pregnancy. What happens when a woman decides to take up such a family planning method?
Okay. Thank you, Jim. It's true that family planning, there are those methods that come with side effects, and women are really scared of the side effects. In fact, there are those that really decampaign, but they do that out of maybe ignorance or lack of the information, and this will serve to bridge that information. Now, when we come to family planning, we have different categorizations. There are those that we call short term, there are those that we call long term, but the major one, the major categorization classifies them into two. We have the hormonal and then the non-hormonal. So most of the side effects are due to the hormonal type or methods of family planning. Reason being, they contain what we call a hormone. Hormones, these are chemicals that normally the body produces from one part, and then they move in blood to have an effect at another part of the body. So just like the natural hormones that the body produces, equally true, these hormones that are in these family planning methods, they also have an effect. But some of their effects are good. For example, they will prevent you from getting pregnant. But in so doing, they may also present with some side effects. For example, there are ladies that experience irregular bleeding after using certain types of family planning. There are those that really do not go into these periods. I think you'll appreciate that as much as some of these side effects may be really not wanted, some of them may actually be beneficial. Yeah. So we also have women that after taking this family planning, they become fat. Yeah. You'll appreciate which family planning method is mainly associated with weight gain. Now, the hormonal ones are the ones which are majorly associated with these so-called side effects that women fear, and therefore they do not want to take on. The other common one, the common misconception is to do with maybe I will become infertile, but there is a common side effect of some family planning that have delayed return to fertility. But by and large, the modern family planning methods are safe to be used. They do not cause infertility. When I say modern, it's because this family planning method started being used starting from 1960s onwards. Yeah, so Jim, I think that will help to clarify.
It throws a highlight to the side effects. There's something you mentioned, certain side effects are beneficial.
Yes.
Also, I noted you said we talked of the modern family planning methods that are hormonal and those that are non-hormonal.
Yeah, sure.
Perhaps you can start there. You let us know about the hormonal side effects. I mean, the hormonal family planning methods, the examples that come along with these other fear that bring fear in women, to do with infertility, to do with heavy bleeding. Let us know about those.
All right, so that is an important question, and it's better I change my position because it's going to be a long one. Now, family planning, ladies and gentlemen, our gym for that matter, like as I said, is categorized in two major divisions. We have the hormonal and non-hormonal. Under the hormonal, to start with, we use mainly two hormones. We have the progesterone hormone and then the estrogen hormone. Before I go into the different examples, how do these hormones work? So progesterone is a hormone that suppresses what we call the LH surge. LH in full is luteinizing hormone, and that hormone is responsible for ovulation, the release of the mature egg from the ovaries so that it can be fertilized. So progesterone suppresses what we call the LH surge. When that happens, the release of the egg will not take place. That's one way how it acts. The other way how it acts is that it increases the thickness of the cervical mucus, and its purpose is to delay or stop the movement of the sperm from reaching the egg. Yeah, it also causes what you call endometrial atrophy. So usually when the fertilization takes place, usually the uterus is supposed to be nourished, well prepared, and expecting to receive the fertilized egg. But when someone takes these family planning methods, such nourishment of the womb or the endometrium does not happen. It simply means that implantation cannot take place. This progesterone also decreases what you call the movement of the motility of the fallopian tube. Remember that when the egg is released from the ovaries, it has to move as it waits to meet the sperm. So this hormone decreases such movement. Now that is one hormone, and this hormone is responsible for majority of the side effects. Progesterone, mark that. Yes. It is responsible for majority of the side effects. It is also the hormone which is responsible for contraception. It's the one that we use to prevent someone from getting pregnant. What then does the second hormone do? What we call estrogen. So estrogen, it comes with its benefits. One, how it acts, one is that it suppresses what we call the FSH, what we call the follicle stimulating hormone. This hormone is responsible for the maturation of what we call the dominant follicle. So when I say follicle, this is where the ovaries are, or this is where the ovum grows. Yeah. So it suppresses the growth and maturation, so that there is no growth to form an egg which can later be released to be fertilized. But then also this estrogen has its benefits. One is to counter most of the side effects of progesterone, the likes of irregular bleeding. So when you speak of hormonal, there are those methods that contain only progesterone. There are those methods that contain both estrogen and progesterone. Remember, I mentioned something to do with progesterone being responsible for most of the side effects. Let me just highlight some of them. One of them is that there are ladies, whenever they take such family planning, they experience what called breast tenderness, painful breasts. There are those that experience headache. There are those that experience irregular bleeding. Some of us know it as spotting. There are those that never go into periods, what we call amenorrhea. But actually this can be beneficial. Why? It can be beneficial in case a lady is predisposed to anemia. So if you are not bleeding, you're actually preventing yourself from being more anemic.
Preserving blood.
Exactly, that is it. Yeah, so also this progesterone is also associated with irregular blood sugar metabolism. So there are those that actually get what you call diabetes during pregnancy. It's because of the progesterone. Now, when you come to the estrogen, as much as it is good in countering some of the side effects, it also has one major side effect. Yeah, and that side effect is associated with clots. Yeah.
Clots.
Yes. That's why there are some hormonal methods that we do not use in women at risk of getting what we call deep vein thrombosis, or what we call venous thromboembolism, or what we call pulmonary embolism. It's because of the estrogen.
These are simply clots.
Yes. When I say exactly, it increases on the chances of someone getting a clot.
Clot within the
yes. And what are the shortfalls of someone having a clot? When a clot is formed, it can dislodge, it moves, or it moves in blood, it causes blockade of some of the tiny vessels within the brain, and that's why we speak of someone having a stroke, which is not good. Let's now break down the different hormonal methods that you can use. I think most of us are really interested in this. So we have what we call the combined hormonal contraceptive methods. When I say combined, they contain both progesterone and estrogen. And these are, we have the pills, the ones that you swallow. Yeah. So these ones, you take them daily. For them to be effective, you have to take them at the same time. Yeah. If you have been taking it maybe at 6 p.m., it is preferred that you take them at exactly 6 p.m. Why? When you skip like maybe 2 days, you may get pregnant. But we shall understand how you can maybe use these pills for those of us that have skipped. What do I do? Maybe those that do not want to bleed, we shall appreciate that. But generally, you take them daily. Now, some of them, they come as 28 cycles, but usually the first 21, those are hormones, and then the other 7, it is just what we call a placebo. They are just tablets but without a drug. So you take the hormones for the first 21 days, but note, the first 7 days, we want you to use what we call a backup method. Why? It takes time for this hormone to build up in our body to effect that suppression. So the first 7 days, when you started taking these pills, you go with a backup method. You can go with an emergency pill, or you can go with a condom. So after the first 21 days, you take the other, what we call the placebo, and this purpose is to trigger what we call a withdrawal bleeding, so that you can go into your menses. So these are the pills. We also have what you call the patches, transdermal patches. These are small square patches about 2 inches across that you put on your body. They also contain these hormones. For them to be effective, you have to fix them firmly on the body, and they are supposed to be replaced every week. So they keep releasing that hormone to suppress ovulation. Those are patches. Actually, patches started being used from 2014. That's when they started being used. Since then, there are others. So the third one is what we call the vaginal ring. So these are small circular rings, flexible, about 2 inches in diameter, that you insert in the vagina. You leave them there for 3 weeks. So the purpose of removing it after 3 weeks is to trigger what you call a withdrawal bleeding. So those are the combined hormonal contraceptive methods, where we have the pills, we have the transdermal patches, we also have the vaginal ring.
Vaginal ring.
Yes.
Can you make something clear? You said there is the withdrawal bleeding.
Yes.
Yes?
Yeah.
You talked about it in the pills. You also mentioned it under the vaginal ring.
Yes.
Can you elaborate more about that?
Yeah,
withdrawal bleeding.
Sure.
Yeah.
Good question. So, when you take family planning, like as I said, it suppresses ovulation and that kind of stuff. Yeah. Now, bleeding usually happens. You need to note this. Bleeding usually happens when fertilization has not taken place. Isn't it? Yeah,
that is true.
That's why when ladies usually come to buy the HCG strips, it's only when they have not seen the bleeding.
They have missed.
Yes, they have missed their bleeding. So they suspect maybe fertilization has taken place. So the point is this. But why does the bleeding occur? The bleeding occurs when atrophy happens, when the nourished womb breaks down. Why? It has not received the fertilizer, so it has to break down in preparation for the next cycle. So when someone takes these combined hormonal pills, so for the first 21 days you want you to be on these pills. Why? You are suppressing ovulation, you are suppressing what you call nourishment of the endometrium. You are suppressing it. Yeah. So when you terminate on the 21st day, then you give chance to the body to start nourishing the womb. Yeah, to nourish in preparation. But remember that after the 7 days of not taking these pills, you again start another cycle. So in these 7 days, you give the body the signals if you want to bleed.
To go into
Yes.
Call them periods.
Yeah, periods. So the purpose of not taking this hormone the last 7 days of your cycle is to give a signal to the body to go into the phase.
The bleeding.
Yeah. And by the way, we need to appreciate this. There are ladies who keep saying that I want to have my peas. There is a perception that if I do not bleed, that blood is accumulating within my body.
Very, very good.
That is accumulating in our body.
I have received someone telling me I've not gone into my pills for the last 6 months, and they are afraid that for every month they have not seen their pills, blood is accumulating inside them, and they are worried. And I think we need to elaborate that. People who miss their pills, women who miss their pills during these family planning methods. What's behind all this? Now,
that's a good question. Like as I said, this family plan, they suppress these processes. So generally, if someone is continuously on these family planning methods, generally they may not bleed. We need to clear this. If someone is on these family planning methods, taking the hormones continuously non-stop, some of them may not bleed. Some may bleed due to genetic variations. We respond differently to these drugs. But by and large, there are also benefits if someone does not go into these pills. We need to appreciate that. Let me highlight this. Whenever a lady goes into her periods, she experiences what we call premenstrual syndrome symptoms. These are changes that happen when a lady is bleeding. Some of them is emotional ability. There are those that become emotional with mood swings.
That's true.
When a lady is in her peace,
they get angry so easily, irritated. That is true.
Yes. There are those ladies who experience cramping pain whenever they go in this piece.
I've seen someone, she has to get
an injection. Yes.
As a painkiller.
Yes.
It's too much.
There are those who even get admitted whenever they go into this piece. By the way, it's not good when a lady is having painful cramps. There could be something. Now that's maybe something for another day. Now there are those of us that experience bloating. Ladies, whenever we go into this piece. So, as much as most ladies actually want to see this blood, to a certain extent it may also be beneficial even if you do not see, as long as you're on these family planning methods. So the reason was why there are two reasons as why people may not go into these pills when they're on these family planning methods. One, it may be due to our genetic variation that we respond different to these drugs. But then also two, if you're continuously taking the hormone, on a daily basis, you'll actually not bleed. And that explains, or that brings me to another point, that as a lady, you have the freedom when you're in this family to choose when to go into these pills. So you can literally use these oral contraceptive pills, the one that you swallow, for a continuous use or what we call an extended use. Those are two keywords. Mark this. For a continuous use or an extended use.
Extended use.
Yes. This is what I mean. That a lady may choose, let me start with extended. That a lady may choose to bleed only 3 times in a year.
Okay.
If she so wishes. Yeah. So
and,
what she, yes.
All this other period, the time she's doesn't
fine.
go into her pills.
Yeah, exactly. She may choose to go into her pills only 3 times in a year.
That's interesting.
She may choose. So in such a case, she may choose to be on these oral contraceptive pills for 4 months. Yeah, taking the hormone for 4 months. So how it works is that, remember I said that most of these combined, the 21 days contain the hormone, and then the other 7 contain a placebo, no hormone in it.
That trigger.
And remember, the placebo is the one that triggers what you call the withdrawal bleeding. Now, how do you use them to prevent you from going into the pills? Listen to this, and this may be beneficial to some women who do not want to bleed for a number of reasons. Is that when you take the first 21 days of the hormone, you do not take the placebo, you do not take the other, some of it is brown or what, or that color, or yellowish, so you do not take them. Instead, you just get another cycle and start taking the hormone. In short, you skip the placebo.
Okay.
So
the
you
last 7.
Yes, you do not take
away with them.
Yes.
And start
just
in another.
Exactly.
Okay.
You start with another cycle with the hormone.
Of the other 21.
Of the other 21.
I see.
So when a lady does this, she will not go into her pills.
Throughout, as long as she's maintaining that.
Exactly. So at the time when she chooses to bleed, then she swallows the other 7, the placebo, the other 7.
That's interesting.
So a lady has that freedom to choose when to go into her pills.
I think it will help women.
Yes.
Who normally, for some good reasons.
Yes, and I'll give you one reason. In the community pharmacy here, I have received women who say, I have a husband who's always on safari, and sometimes he pops in abruptly.
Anytime.
Yeah, anytime. So I do not want him to come when I'm bleeding.
Find me bleeding.
And if this lady is on family planning, she has that option to do it. That she just keeps taking the hormonal, until when the man comes. When the man goes, that's when she can trigger a withdrawal bleeding.
I see.
Yeah.
That's a free giveaway.
Yes. Then there are also these women who are always on the streets. They want to look for money. The sex workers. Nekolela jange.
I see.
Yes. So these ladies are always working day in, day out.
Throughout the year.
You may ask, don't they go into their pills?
Exactly. That would be the question.
Yes. So there is that option.
By the way.
Yeah.
That would be a question.
Exactly.
Every single day they're out to work.
They are out at work. Yeah, so
this would be a good solution to them.
So for extended use, you can choose maybe after every 2 months, I can choose to bleed, or after every 3 months, I can choose to bleed.
Doctor, amidst all this,
are
you not cautiously saying I won't see my pills for the next maybe 6 months? Let's put it clear. No one should be afraid that blood is compiling inside their body.
No,
it is very safe.
It is safe. Remember, bleeding only happens when the endometrium breaks down. Remember, bleeding is different from ovulation. Actually, most people say that when I'm bleeding, that's when I'm ovulating. Actually, that's not true. Ovulation usually happens on the 14th day of your cycle. Yeah. Whereas bleeding, the first day when you bleed marks the first day of your cycle. So they are totally different. Yeah. So, and bleeding indicates that fertilization has not taken
place for that month.
Yes.
That cycle.
Yeah, but it's also true that you cannot bleed and you are not pregnant if you are on family planning.
Come again?
It's also true that you cannot bleed when you are not pregnant. Yeah, but that's when you're on family planning. There are also ladies who have what you call a hormone imbalancing, of which we can always give you some supplements to correct that.
Talking about that, people who have already witnessed some of the side effects, the ones we just talked about, who are spotting, who have serious cramping, bleeding abnormally, heavy, prolonged, how do they get away with that to be able to go back to how they used to be? How do they go about resetting their body?
So it's a bit broad, but there are different cases under which a lady can have what you call such bleeding, and in most cases it can be due to changes in their hormones. Now there are a number of reasons when such changes can happen, when there is what called hormonal imbalance. So one of it can be use of certain either family planning methods or emergency pills, morning after pills. It can either be due to stress. So in case there is that hormonal imbalance, we have some supplements we can use to normalize that. Also, we have some drugs on market, usually they contain an estrogen, that we can use to balance the hormones. So it's also important, if the pain is so persistent, it's also good that you do a scan. Is it maybe an issue of having fibroids? Is it maybe an issue of having cysts? Is it maybe an issue of having infections? So it's also good that you carry out some tests. You can do a scan, an ultra scan, abdominal ultra scan. So, but if it is basically you have used an emergency pill and then you experience that, you've used family plan, then you experience that, and it's important or imperative that you come to the pharmacy as soonest as possible, so that we can give you something to normalize that. It's not good to always have irregular periods. It means that the hormones are not balanced. And if the hormones are not balanced for a longer period of time, it may have a ripple effect.
Among the imbalances, does it also include women who go into their periods twice a month? A cycle, within that cycle, go there twice?
I've actually had some ladies who've gone into P's within just less than 28 days. It happens. Now, something to note, usually women tend to have different cycles. There are those that are 28, there are those that are relatively less, there are those that are slightly longer. But listen to this. When I say it is irregular, it means you have been previously having regular. Yes. Let me say this. If you have been bleeding once in a month, maybe since you started bleeding as a lady, and then maybe after using some, you start bleeding twice, we can categorize that as being irregular. Now there are ladies that have been bleeding twice ever since they started bleeding. Now that may be a different case. Yes. So we call it being irregular when there is a deviation from the usual. That's when we can call it abnormal, irregular, and that's when you can always come and we do this.
Another point of concern when it comes to use of family planning methods is to do with fertility and infertility. You had talked about it earlier on, but I know there is a lot about it, and it's one of the biggest reasons why women say to do away with the family planning. People have a perception that when you use family planning for longer, actually you get infertile.
Yeah, good. So let me start by defining what infertility is. Infertility is when an adult, a lady who is an adult, childbearing age. When I say childbearing, you're between the ages of 15 to 49.
49.
Exactly,
49.
you're childbearing. But of course, I'm cognizant of the fact that we've had stories when ladies below 14 have gotten pregnant.
Yeah.
We've also had stories when a lady is above 49 and they have also gotten pregnant. So that aside, the fertile window is from 15 years up to 49 years. So infertility happens when a fertile woman is unable to conceive within a space of 1 year, even when she has regular unprotected sex. Yeah.
To put it clearly,
yes,
someone is active,
sexually active
for a whole year,
and you must say this: unprotected,
yes,
sexually active, unprotected sex within a space of 1 year, and she's not conceiving.
That's infertility.
That is infertility. It affects everyone, males and females. So we should not only say that infertility happens to the women. No,
that's the notion.
That is not right. It also happens to the men. Only that society tends to blame more the women. Yeah. To just put it in context, 1 in every 6 adults experiences infertility, at least in the due course of their lifetime.
No, despite of being a woman or a man.
Yes, 1 in 6 adults. So as we come to family planning, let's have that at the back of the mind. Otherwise we may be biased that everything is because of family planning. But having said that, these family planning methods, there are those that we call short-term and then long-term. Now the method that you choose is dependent on your desire. It's dependent on how soon do you plan to have children. How soon do you plan to return to fertility? Remember, when you're on family planning, you cannot conceive. Yes. So the short term, if maybe you plan to have children in the next 6 months, 3 months, then you have to choose a short-term method. Maybe the pills. Yes. Maybe the injection. Yes. And then thereafter you can return to fertility.
Doctor, injections. I know of injections that take, one injection takes you 3 months.
True.
But I know of others that take you longer.
Yes. So when we say short term, these are like on a monthly basis, you take a cycle of the pills, or after every 3 months you take the injection. Those are short term. But we also have what we call the long term methods. Usually we prefer long term for those that are planning child spacing. Yes, I've just had a baby. I want maybe after 2 years, that's when I can think of having another baby. In such a case, you choose a long-term method, maybe an implant, of which we put under your arm, under the skin of your arm, or you can use an IUD. Yeah. Now, these long-term methods, there are those that are hormonal and non-hormonal. But to answer your question, infertility. Yes. So one of the major side effects of the injection is delayed return to fertility. That one is known. The injection is delayed return to fertility. It does not mean it has permanently made you infertile. It has just altered your fertility cycle. You get?
Is there a time, you said delayed return to fertility? This delay, is it defined in terms of time?
Now, this delay varies from person to person. There are ladies who, after withdrawing from the injection, they return to fertility within a month.
Sure.
Yes. That after 1 month they can conceive. There are those that can take 3 months. There are those that can take even up to a full year.
Yeah.
So that varies from woman to woman. It is not a defined time frame that after 3 months you're going to return to it varies from person to person. Yeah, so also this injection is also associated with weight gain. So there are ladies who are really small in size that they want to put on some weight. Yes, so she chooses the injection. Yeah, she chooses such an injection. She puts on the weight, but in case the side effects outweigh the benefits, she may have to choose. She may have to change the method. But in case she's able to achieve her desired weight, at the same time she's able to return to fertility whenever she wants to conceive, then she can choose to use the injection.
In my mind, doctor, something is running. What brings about the weight? A viewer should be wondering.
Yeah.
Get an injection and you start putting on some weight.
You see, these are hormones, and these hormones they change the metabolism of a person. But then also some side effects, we observe them over time. Yeah. I may not really answer that maybe it makes you to deposit more fat, but when you observe a woman who has taken an injector plan, some books people know it as Depo-Provera. Yeah, so when you take it and then maybe after 3 years someone has put on weight. Yeah, it's a common side. Some side effects may be explained based on how they affect the physiology of someone. There are those that really you may not explain. Yeah, so but that is a common one. The same way it also affects the blood sugar regulation of such people. Yeah.
I say it would be beneficial for someone who is struggling to put on weight.
Yes, I've actually received quite a number. They are small in size, so they come and inquire, Musa, which method can I use so that when I go into marriage, I put on some weight. Yeah, so the injection is usually the one that's associated with ladies putting on weight.
Okay.
Yeah.
So we are coming to this part, which actually brings concerns between couples. In the pharmacy, sometimes you receive only ladies coming to get themselves a family planning method without their partner's consent, not consent but opinion or even contribution. How should it be like if a woman, they are in a relationship, decide to take up a family planning method? What would be the ideal? Yeah.
Okay, thank you for that. To just say something, ever since the introduction of family planning, they gave women some sort of freedom to choose when to have children or whose pregnancy to carry. Yeah. So to come to your question, if a woman has decided to get pregnant for you, she'll actually be pregnant for you. If she does not want to get pregnant for you, she can actually choose not to, either by preventing or by terminating.
By terminating.
Yes,
even when she's in my home as a wife.
Yes. She
interesting.
Yeah, but that put aside, it's good practice that you choose a family planning method when you have agreed with your partner in case you're in a relationship. Yeah, it's good because it informs on the other party on what you're planning together. It's good practice. Now, there is a family planning method which may be a bit private. Yeah, that's the injector plan. Yeah, so Actually, most ladies can be on a family planning method without the man knowing. Yeah.
Why, in particular, why the injector plan?
Yeah, because when someone has taken the injection, will not know that she has had an injection. But sometimes when a woman is on pills, sometimes you can see her swallow and then you can try to find out. Maybe a woman has had an implant put in. You can observe some change on her skin and then you ask why, what happened. Yeah, you can maybe see a woman putting on a patch on her body and then you ask why, what is happening. Sometimes there are those that use IUDs, then they get an infection. In most cases, we usually say treat this infection and remove the IUD. So the injector plan or the injection remains an option that's very discreet to a woman.
I see.
Yeah, but to answer your question, it's actually good as a couple you discuss on the type of family planning to use, and the choice is dependent. One, when do you plan to return to fertility? When do you plan to get pregnant? Two, the health condition of the lady. I've not talked about contraindication, but some of these are contraindicated in certain categories of women. Yeah. And then three, because of religious and societal or cultural beliefs, some people may not use certain methods, so they have to opt for other methods. Yeah, so you really need to choose.
Can we be more specific on that?
Yeah, for example, with Catholics, they believe hormonal family planning methods are not supposed to be used. Yeah, it's a religious belief to them. They believe you're supposed to produce.
So when times I get that, I appreciate it.
Yeah.
What about in a situation where there is a need to pause?
Exactly. So for them, in such a case, in most cases they opt for what we call non-hormonal methods.
Non-hormonal.
Yes, and when you say non-hormonal, there are different types. We have what we call the copper-bearing IUD, which is a long-term method. It can last a woman 3, 4, or even 10 years, depending on the dose of the copper that is there. We have what you call behavioral methods. For example, the fertility awareness behavior method, where a lady follows what we call safe days.
Safe days.
She chooses to have sex only during the safe days.
The safe days work?
Well, to just put it in context, the fertility awareness based methods, and this is where we have the safe days and withdrawal, they are the most unreliable methods of family planning. Reason being, if used incorrectly, of which it happens, people get pregnant. So do they work? The question is yes, however, with much caution. They can work only and only when someone uses them correctly. And the percentage is actually low as compared to other family planning methods. Yeah.
Okay.
So you asked about that. So I said the religious beliefs believe you should not use the hormonal. So it means you are left with non-hormonal, of which I mentioned about the behavioral methods, where there are two: the withdrawal and then also the fertility awareness. Yeah. So the non-hormonal, we've understood that those that have religious or cultural beliefs can either choose the behavioral methods, where we have the fertility awareness method, where we speak of the fertility or the use of the safe days, and then withdraw. We also have what we call use of condom. Yeah, these are barrier methods, where there are two. We have the use of the condom. Remember, condom is the only family planning method that can protect us from pregnancy, as well as UTIs, STIs, or even HIV infections for that matter. I'm also aware that some women are sensitive to latex. They also what we call non-latex condoms. But of course, these do not protect you from the infections. So we also have what you call use of diaphragms. Some of them come with spermicides, but spermicides are actually not good. Why? If someone is having HIV, they increase the virus shedding, so you can easily transmit to the other partner. So in some countries, use of spermicides has been banned. Then you also have you call the permanent methods. Yes, permanent method. When I say permanent, it's in that when you go for such a method, you have really accepted in your mind in a clear state that you do not want to give birth
again,
because when you go for it, there is no return. It's not reversible. It is irreversible. So for the side of the ladies, we have what called the tubal ligation, where you cut the fallopian tubes and you tie them so the eggs cannot be released to come and meet the sperm whenever you have intercourse. For the side of the men, it's called vasectomy, and it's good. Why? Here a man can choose to have intercourse with his wife whenever he wants with no fear of getting pregnant. However, it's good that you tell your women, because lately we have been having challenges whereby a man has had a permanent method but the lady is pregnant. So you really have to tell your woman that such and such happened. So for that one, we cut the tubes, we call them vas deferens, that transport the sperm to go and meet the semen. By the way, something to note, when you have had this vasectomy, it's good that you give yourself 3 months for the body to completely eliminate all the semen that was initially having the sperms. But also when you have a man has had this vasectomy, they can orgasm normally, they can ejaculate normally, they can release the semen normally,
they perform normally.
Exactly, but that semen will not contain the sperms. So the last non-hormonal method, this is common with breastfeeding women, it's called LAM, lactation amenorrhea method. So this is effective to women who have just given birth, and it has its conditions. One, the woman should be exclusively breastfeeding, meaning you have to feed your baby on breast milk. Two is that the kid should be below 6 months, so you do it for 6 months. And then lastly, during such breastfeeding, a woman should not go into herpes. So if a woman has just given birth, she is exclusively breastfeeding and she's not in herpes, even if she's to have intercourse, she'll be protected even when she does not take the family planning methods.
Does this particular method apply to every woman?
Yeah, but not the 3 conditions. A woman does not go into herpes. A woman is exclusively breastfeeding. And it should be the first 6 months. Postpartum or after giving birth. Yeah. So when she does that, it is effective. And it is simple. It's an issue of hormone. When a woman is breastfeeding, there is a hormone which is at play, prolactin. So prolactin stimulates release of the breast milk, but it has a negative feedback effect on what you call the hypothalamus pituitary ovarian axis. That's the axis that controls fertility in women. So it promotes milk release but suppressing that.
There's activity.
Yeah, so that's how it works.
Okay, that's interesting. Doctor, lastly, there is a question. But there are so many questions I know you people should be having out there, and if we've not talked about it here, I know there are so many questions you people should be having out there. So if you've not had your question, feel very free to leave them in the comments below, and of course we shall always have your time to answer them as needed. But before we close, there is one particular question. If a woman tries method X and it does do unbearable harm, they can't bear the side effects, do they give up with family planning, or there is a way out for such people?
So Jim, like as I've said, we have the hormonal methods and the non-hormonal. So there is a plethora of methods that a woman can select from, as long as she's eligible for any of them.
Eligibility.
Yes. So let me first highlight eligibility. There are those methods that are contraindicated to certain categories of women. And it's important that you discuss this with your healthcare provider. Ladies, open up and share necessary information when you're choosing a method, why it guides in selecting the appropriate method for you. Now, for the combined hormonal contraceptive methods, where we have the pills, we have the patches and vaginal rings, the following categories of women may not use them. Actually, let me not use the word may, should not use them. You are a woman about 35 years and you smoke cigarettes, a minimum of about 15 cigarettes per day. You should not use them. 2, you are a woman and your blood pressure is equal or in excess of 160, being the systolic, and 110, being the diastolic. You should not use them. 3, you have a history or you're at high risk of what you call VTE, venous thromboembolism, which can either be DVT, deep vein thrombosis, or pulmonary embolism. You should not use them.
If someone has such a history.
Yes, they shouldn't use them.
Do you mind explaining this in a clear term for them? VTE and DVTE.
Yeah, so like as I said, combined hormonal contraceptives contain estrogen. And estrogen, one of its side effects can predispose to someone having a clot. So when I speak of VTE, venous thromboembolism, is that you can easily have a clot in your vein. So there are people who are really predisposed. Let me just mention only one category. Okay, 2 categories. If you have a history of a stroke before, I wouldn't advise you to take it if you're a woman. 2, maybe you've had an operation. Yes, you've just had a major operation and what. You shouldn't take it. Or you are hospitalized most of the time. Yeah? Or you are immobile most of the time. You're bedridden most of the time. We wouldn't advise you to use this combined hormonal contraceptive. Why? You're at high risk of an embolism or a clot, for that matter.
So these people here,
are
they free to use the other?
Good. Yeah, so if you fall in this category, then you can opt for other options. For example, to use only progesterone only pills, POP, progesterone only pills. And this can either be progesterone only, the tablets. They are actually something to note. There are women who are breastfeeding. If you are breastfeeding, you shouldn't use combined hormonal contraceptive pills.
The reason?
Yeah, it is going to cut off the breast milk. Yeah. Remember prolactin and the other? I say that when prolactin is high,
it suppresses the activity of the other.
So when someone takes the combined, is activating the other, so that hormone is high and suppresses. And the reason is simple. We have the anterior and posterior lobe of the pituitary gland. So prolactin is produced from one side and then the other hormone is produced from the other side. So when the other lobe is active, this one is suppressed. Yeah, so when you take, you're going to cut off release of the breast milk. However, such women can benefit from what we call progesterone only pills.
That's a very important.
Yes, progesterone only pill. They take only pills containing progesterone.
Do you have this available?
Yeah, they are there. We actually have them even at Masapharm Pharmacy. There's a brand called Microlute. Yeah, it contains only a progesterone, and that one will not interfere with the milk let down.
I think that's very important because there are mothers who may not know this.
So maybe to finish some of the contraindications, now we have what we call we have the implant. So for the issue of the implant, if a woman is having what's called active breast cancer, they shouldn't use an implant.
The one?
Yes, the one that you put under the arm. They shouldn't use an implant. Whereas these others, maybe the side effects may be really too much that they may not use them. For example, the injection, the one for 3 months. There are those that may put on weight, yet they do not want. Yet others may want. So that one is dependent on what you want. 2 is that maybe you have started using the injection and then you realize an increase or a deviation in regulation of your blood sugar. You realize you are tending towards being a diabetic. So in such a case, you move away from such a method and you opt another method which is safer. Now, if I told generally for you are not a person of hormonal, then we have an option for you to use the non-hormonal. In which case we have the IUDs, we have the behavioral methods, where we have the safe days and withdrawal, of which it is highly not reliable. We also have what we call the LAM, the lactation amenorrhea method, in case you are breastfeeding. Or in case you are completely finished giving birth, you can choose the permanent methods. So it's true that in case one method is not working for you, you can switch. But as you switch, choose a method which is safe for you. By the way, maybe before I leave that point, so there are these that use IUDs. So if you are such a person who, whenever you use the IUD, you get infections, then you should move away from such a method and use another method. But generally, IUDs are actually safe. They're actually very, very reliable in terms of preventing someone from getting pregnant.
Thank you so much, Doctor, for the time and also for the knowledge sharing with us. You understand there are so many questions regarding this very topic here, and I know if we had the interaction with our viewers, we could still go for another hour. So I'm going to request them to pardon us. We shall end this episode here. In case there are questions out there regarding family planning, feel very free to drop them in the comments below. We shall be able to come back and, of course, where need to be, highlight and also guide as needed. However, as we finish, don't forget all these family planning methods will need you to engage a healthy professional so that you are guided. So whether you have a trusted facility, make sure you seek a professional's attention before you get started. And also, as we shared earlier on, if possible, engage your partner so that you plan together. As we wind up, Doctor.
Thank you, Jim, and it's always a pleasure to be hosted by you on such a wonderful podcast. So as we conclude, did you know that WHO, in a bid to extend family planning services to the common person, especially in resource-limited settings now, like here in Uganda, they have tried to partner with a number of organizations. And here in Uganda, we have the likes of DKT, we have the likes of TICO, and we must say that we are thrilled to partner with TICO and DKT to provide reproductive health and family planning methods to the population.
This is as Masapharm?
As Masapharm, we have partnered with DKT and TICO to provide reproductive health, that is family planning, both in short-term and long-term. We are like distributors, but as a pharmacy we can offer in the short-term methods. So I advise you to always seek out for the right family planning method based on what you need, and always seek guidance from a professional so that you do not be there in abyss wondering, family planning, is it effective or not? Does it cause infertility or not? All these can actually be answered when you visit the rightful healthcare provider. And I hope to see you maybe at a further engagement. If Jim really wants me back on that show, I'll definitely be available for you and then also to share information. Thank you.
Thank you so much, Doctor. We shall definitely have him because we shall need his expertise on several topics. So expect him. And you mentioned about your Masapharm collaboration with TICO, where you are able to offer different family planning methods and counseling.
Yeah, truly.
I think that's a very nice one. And in case you're out there and you're interested in these services to plan for your life, you are a school-going student, you are a mother who wants to space children, whatever scenario you're in, as long as you want family planning methods, I think this is a very good opportunity that you can take up and set yourself for success. Remember, planned kids are always a joy to you, the parents. Until next time, peace. See you in the next one.